When should high-risk individuals get a breast MRI? Imagine catching breast cancer early when it's most treatable. That's the goal of screening. For women at high risk, starting screening early can make a big difference. But exactly when should they begin? Let's explore the facts. High-risk women should usually start annual breast MRI screening between ages 25 and 30. This is earlier than the typical starting age of 40 for average-risk women. The reason is that high-risk groups tend to develop breast cancer at younger ages, and MRI is the most sensitive tool for early detection in these cases. If someone carries genetic mutations like BRCA1 or BRCA2, they should begin MRI screening at around 25 to 30 years old. These mutations significantly increase the risk of developing breast cancer, and cancers in these women can be more aggressive and appear earlier. The same applies to women with other hereditary syndromes, such as Li-Fraumeni or Cowden syndrome. Women who had chest radiation between ages 10 and 30 also need to start MRI screening early. Radiation can damage breast tissue and increase cancer risk decades later. For these women, screening should start at age 25 to 30 or about years after their radiation treatment, whichever is later. Another group includes women with a calculated lifetime breast cancer risk of 20% or more. This risk is assessed using validated models that consider family history, genetics, and other factors. If their risk hits this threshold, they should begin annual MRI screening at 25 to 30. Women who have had breast cancer diagnosed before age 50 also need careful monitoring. If they have dense breast tissue or other risk factors, their doctor might recommend starting MRI screening early. The exact age depends on personal circumstances and should be discussed with healthcare providers. Screening with MRI is recommended to be annual and often works best when combined with mammography. Usually, women at high risk start mammograms at age 30, while MRI begins at 25 to 30. These tests can be scheduled close together or staggered by about 6 months to maximize detection and reduce stress. MRI is the most sensitive imaging method for high-risk women, especially for finding small or early cancers. However, mammography adds value, particularly in women over 60, where combining both methods improves detection. For example, women aged 60 to 74 benefit from both MRI and mammography, especially if they have dense breasts. The American College of Radiology recommends that all women, especially those from populations with higher risk like Black women or Ashkenazi Jewish women, undergo a risk assessment by age 25. This helps determine if earlier screening is needed. Personalized risk assessment considers family history, genetic testing, and personal health to guide screening decisions. If someone cannot tolerate MRI due to claustrophobia or metal implants, contrast-enhanced mammography can be an alternative. Still, MRI remains the preferred screening tool when possible. There's no strict age limit for stopping high-risk screening. Decisions about screening over age 75 should be personalized, considering overall health, life expectancy, and personal preferences. Regular screening in these high-risk groups aims to catch cancers early when treatment is most effective and improve survival chances. Remember, these guidelines are based on current scientific consensus and can vary depending on individual health. Always consult your healthcare provider for tailored advice. Early detection saves lives, so if you're at high risk, talking about your screening plan is a vital step toward protecting your health.